All right. So, hi everyone. Welcome back to Cells to Cell. My name is Heem. We have Nick, and today joining us is Dr. Mona Hardas, MD. We're gonna go ahead and let Dr. Hardas introduce herself. She's an OBGYN, but she does a lot more with her life than just being an OBGYN. So, Dr. Hardas, if you want to go ahead.
Hi guys, as Heem said, I'm Mona Hardas. I'm a practicing OBGYN from Flint, Michigan. I also am associate professor at the Michigan State University College of Human Medicine. Love to teach my medical student as well as the residents about gynecology. I started my career as an OBGYN and then shifted into gynecology, and now my next step is that I'm practicing mostly cosmetic gynecology.
That's
Nice
great.
meeting you guys.
Yeah, thanks for coming on. We appreciate it. To all the viewers at home, just really fast, we know Heem and I both know we kind of disappeared for a couple months, but we're very, very happy to be back. And this is an amazing guest to have first. So to start off, why don't you just tell us a little bit about like your background, your schooling, where you might be from, and kind of how you got into medicine?
Wow, I have to go long time back. I don't want to give my age, but it was years ago. Well, I was born in India, and my undergraduate as well as my medical school was in India. As you know, in India, after high school, you straight go to medical school. So I did my medical school there. I did an MD OBGYN in India. That was followed by my journey to England. I was in United Kingdom for about 6 years, pursuing MRCOG, or which is another all College of OBGYN degree, which I did, and then I came to America. I did my residency at Michigan State University, their campus in Flint, Michigan, and I did OBGYN residency and training again. And since 1999, I've been in private practice.
Wow. That's awesome.
Yeah, it's been a while.
Yeah. So, you do a lot of other things than just being a practicing OBGYN. Like now you're into cosmetic gynecology. And by the way, for all of our listeners, you should follow Dr. Hardas on all of social media. She posts a lot of great content all the time. She even has her own book that she's written with her daughters about periods and stuff like that. So we'll like to know more about that. So, starting from OBGYN, when did you get introduced to cosmetic gynecology, and then how did you decide that you wanted to start doing that kind of stuff?
Well, my training and my practice in OB is the one which introduced me to cosmetic gynecology. This is what, 20 some years ago when I started practicing. I was one of the very few female OBGYN in the town where I'm practicing. So I used to get, well, I started getting patients who were worried or had some like female circumcision. Let's start there. They had female circumcisions for whatever reason in the past. They didn't want to talk to anybody. They did not want to see a male gynecologist. And they had problems from painful sex to, once you are pregnant, delivering a baby because of the mutilating surgeries they had. And somehow I have no idea how someone found me. And once one person knows the female OBGYN and they like that person, you get more and more patients. So I started getting more and more patient, and that's what made me start thinking, I need to do something about it. Why do these women have to suffer? Why? That wasn't their fault. They had to go through it. They didn't even know. They were very young. So now what this has happened, what I can do to help them to have a kind of a normal life, and that's when I started researching. There wasn't a whole lot available, but I went to California. That's where a lot of cosmetic surgery was done. So my actually aim was to learn about reconstructive surgery to help. And then obviously starting from there, I got more and more interested. And I think most likely that is what I'm going to be doing full time, is just the cosmetic surgery, which involves not only aesthetic surgery, but also the reconstructive surgery. Because, people could have functional problem as well as aesthetic problems. So
Okay, so can you go a little bit more into detail about the health problems that people get into? So, and then how your solution comes in there, and like what is the actual procedure that you do? Is it like some sort of injection and all that stuff?
Well, there are multiple procedures. There are some which are surgical and some which are non-surgical. So non-surgical procedures, if you talk about it, a lot of them revolve around pain, vaginal pain, pain during sex, vaginal dryness, which could be with multitude of problem. It could be perimenopause, menopause. It could be a woman who's breastfeeding and has low estrogen, people who are on a long-term birth control with a low estrogen, or who knows, a lot of different reasons which they can have pain or difficulty. That's when I do either a laser or radio frequency wave treatment. That is a non-surgical treatment. We also do something called O-shot, or which basically has a platelet-rich plasma, which also helps with the vaginal dryness. It's called orgasm shot. So obviously it helps with the lack of libido or lack of orgasm. But you guys are into regenerative medicine, so platelet-rich plasma has a lot of stem cells, and it does help also with the urinary incontinence, which is one of the area where I treat my patient non-surgically and surgically, as well as people who have scar tissue in the vagina because they had bad episiotomies or scarring or whatnot. We treat them. So if I can treat them non-surgically with these methods, absolutely, I would do that. We do also involve pelvic physical therapy to help relax the muscles down there. Now, surgical procedures, and there are so many of them out there, which may involve if there is a hypertrophy or extra growth of the tissue, which is causing, aesthetically, it's not looking good. It shows through the clothes, or it rubs against the clothes, causes blistering, causes pain, discomfort, vaginal infections, all that we can do surgical reduction of that tissue from that area. A lot of women after childbirth, they had either episiotomy, bad scarring, or they were not repaired properly, and the vagina is either disfigured or functionally they just do not have any sensation. We do vaginoplasty surgery at that time. So multiple of surgeries done, just depending on the problem, I would say.
I have a question. Oh,
Yep. Yeah, go
so
ahead.
with all these surgeries and them being like purely cosmetic,
Mhm.
like are these covered by like people's insurance, or are people paying out of pocket for this? Kind of how are people getting, I guess I'm asking what the accessibility to these surgeries would be.
So there aren't that many people who are trained. I think if when you do a general OBGYN training, we are trained into basic, take care of medical problems and issues. This needs additional training because this is more cosmetic procedures, right? So I did my master's training. I had multiple courses to get there. So accessible, I think your general OBGYN may offer you this procedure, but I would go to somebody who's actually trained in it. That's number one. Number two is it covered? No, it is not covered. Insurances doesn't even cover these procedure because it has a cosmetic thing attached to it. So most of the people, they do end up paying out of pocket. Now, if it's bothering you so much, it is causing pain, it is causing discomfort or a problem in your relationship, it will be worth spending money, because that's not only give you relief of your symptoms, but will also give yourself self-confidence, which makes a huge difference, if you ask me.
Definitely. And
Absolutely.
when thinking about your whole journey of starting to offer this, so what was the first thing that you got certified in, and how did you evolve that into now everything that you're offering?
I went in for my first training was labioplasty training, and that's where I went into California to get that training. As I told you, I wanted to help reduce the excessive tissue, but if people had a bad circumcision, female circumcision, then I wanted to be help create labia. You know what I mean? So that was my first training. So I started with a labioplasty, and then I added vaginoplasty and hymenoplasty, all those surgical procedures which I do right now. And technology is evolving too. I'm talking about this about 10 years ago, 15 years ago. It was just the surgical procedures, but now, because we have so many non-surgical options available, and also the stem cell technology has taken off so much that we can offer that to my patient. I'm very excited that I have patients who are like, who are so excited and impressed that they know it works, and they will come back when it stops working, because stem cells are not going to be there forever, so you have to have treatment repeated. So
Wow. And
so it has been a journey.
yep. And just before we started recording, we talked about how you used to offer your patients, because you're OBGYN, umbilical cord banking, like you were familiar
Yeah.
with all of that. So I guess we
Well,
can like start talking about a little bit of that, and then Nick can go he can
yeah,
tell us a little about his stuff, but
yeah. So umbilical cord banking has been out there for quite a few years. When I used to do deliveries, it was, I think it was in infancy at that time. It was just starting. People had a lot of questions. A lot of banks were coming out. I know there are public banks and private banks right now, and the technology now has, now there's a research showing that the cells have been banked for about 14 years, 15 years before they have been used, and they survive. But as I said, because I'm not doing OB a whole lot, I haven't really looked too much into umbilical cord banking, but maybe Nick can fill us with the new technology and new developments out there.
Yeah,
Nick?
most of the time it's just it's kind of the same, I'm sure that so I work for the Cleveland Cord Blood Center. I've done my internship there all summer, and I'm on the business development side. So I'm looking at all like our new products and everything. But our transplantation stuff is so super interesting, because the way that we do it is you take like umbilical cord, mom and baby, they're still connected, and you clamp both sides. And then you take a syringe and you literally just suck out almost that, it's like right in the middle, it's all this blood, and it's so rich with stem cells. And it's so great because it can be perfectly matched to both mom and baby, and I believe dad. And then like siblings are 50%, and then grandparents are like 50 to 25%. It's so cool. And it's so interesting to watch, how we put them in the freezers and how we process them, and then how we, ship them. And I believe with the FDA, with what we have, we're good for 10 years. I don't know about 14 years, but we can use them for transplantation after 14 or after 10 years. But the technology is so great. And what's great about umbilical cord blood is it is so very versatile. You can use it for so many things, both in medicine and in research, that I've really become like a believer in umbilical cord blood banking, especially working at Cleveland Cord Blood. I mean, it's a small little nonprofit, but we have so much power, and we have so many great connections across the world. And our executive director is speaking with people from all across the nation and the world, and sharing the knowledge we have. And it's so cool to be a part of, and especially getting to talk to like especially like somebody who's done OB. It's just great because I only know it from my side. I would love to hear a little bit from your side, especially how it is, it was then versus how it might be now, because Cleveland Cord Blood takes donations from 7 hospitals, and we train nurses and physicians to do it. And I would love to ask to open, when you were doing umbilical cord blood banking, and where were you? Were you in Michigan or were you in California at that time? And what bank were you working with?
So I was in Michigan at that time, and usually I would have patients choose a bank, because there were so many. I don't know how it is now, but there were so many banks out there, and I always told them, because it's expensive, right? We're going to the private banking, they have to pay money. So a couple things that I told them, I said, do your research, make sure it's an FDA approved bank. It has a good track record, so it's going to be there for a while. And then find out that what is the cost of it, right? So
Yeah.
once the patient has chosen the bank after they did a research, usually the bank will send in a package, with everything in it, like you said, the syringes, everything in it, and then you collect the blood, and its collection is very simple, because the cord is full of blood, and the cord is thrown away anyway. So that blood, you're not taking it away from the baby. It's just a product which would have been thrown away, just collected. It's very easy to just get it out in a syringe and put it into the container, and you just FedEx it. The FedEx will come and pick up the package, and it will be, So that process was very simple. It's just making the decision for a patient. Am I gonna bank it? If I'm gonna bank it, how long I'm gonna committing it for? How long is the blood good for? Those were the question. We didn't have too many answers. It's good to know that for 10 years by FDA. That's really good.
Yeah, so FDA is 10 years, but what's great is, one thing that I find it's imperative in medicine actually is education. And that's something that, doctors, one, don't do enough. And it's not because they don't want to, but it's because they don't have time. The patient population is so big, and especially think about how many women are having babies and how many times they have to go see a nurse and get ultrasounds. And it's one thing that Cleveland Cord Blood, I feel like, does really well is the education about what these cells can be used for and how they can be banked. And like I was talking about, the versatility of them is they can be used for transplantations for people who have gone through myoablation due to their leukemia, and these people find a match with us at Cleveland Cord Blood, and we send it. I remember we sent one out to Oregon, and I mean, that's a 5-hour, 6-hour flight, and everybody waved goodbye to like the shipper as like we rolled it out, and it was so great because that's going to go and help somebody. I think umbilical cord blood is so great, and we can use this to kind of go into. I had a question about your labioplasty, if I'm saying that correctly. I know people who have gone through like using skin grafts and having to replace tissue. Kind of what's that process like? Especially if a female comes in with a previous circumcision and you're doing that labiography. Where does that tissue come from? How does that grow? What's the process kind of in there? Because I didn't even realize that was a surgery until I started reading on your page.
Well, the tissue, you just have to use the outer labial tissue and actually try to make sort of a labia. You have to have a good blood supply to that area. So can you actually make it? It depends upon how much tissue is left behind. If you read about female circumcision, there are 4 stages of it. So stage 1 and 2, there is some tissue left behind, and you might be able to do it. If there's a lot of scarring, you can't. But nowadays, I haven't used it, but there are some companies which are selling amniotic fluid. And now, amniotic fluid has a stem cells in it. So when you do a surgery and the tissue is healing, you actually I put in PRP, or I put in the platelet-rich plasma, which is the patient's own blood and is pretty safe. But there are FDA-approved couple companies out on the market which would have the sterile amniotic fluid samples, to buy, and you can actually inject in to help increase the growth of the tissue. Again, I myself do not have that experience, but there are a couple very well-known surgeons in California who are doing it and publishing research papers on that too.
That was going to be one of my follow-ups. I'm sorry, Heem. I know I've dominated the last 10 minutes.
Go ahead, dude. This is good.
I wanted to ask about, and this is not to discount anybody in your line of work, but credibility wise, one thing that we talked about a lot when we were in our program, when he was down at school with me, is we talked about stem cell therapy, or not we talked about stem cell therapy, but stem cell tourism is what we talked about. And people kind of trying to find a way around non-FDA approved things. But I know that platelet-rich plasma is absolutely is okay. But I was wondering, is that an issue in your field, especially as we see issues of clinics popping up in Florida, Texas, Mexico, and that kind of stuff?
It is an issue, and there are those people all the time. That's why I think patient education is very important. I wouldn't go to save pennies, and you know how the medical tourism is also, right? People go to Mexico, people go to other countries to get the surgeries done, and then you're botched or you have bad infections and you come back. So anytime, if it's your body, if you really want, you have to take care of your own body. So if you're going to have something done, do your research, find out, is it an FDA approved products they are using, is it a person who is well trained, and then do it. What's the point of having money if you won't have your life, right? And these are the elective procedures mostly. They are not life threatening condition. It's not like a cancer or anything. So if you're really going to get something, then do it properly is what I would tell you. Do your research. Now with the internet, it's so easy to find out information. Be an educated person is what I would say.
Thank you.
So, going along those same lines of like safety and everything, so when you first started and you were giving PRP, how did you know, like, were you asking around, were you reading a lot of research to know how much PRP you have to use for one time and then you bring them in again for their second time, treatment and everything, because PRP is not like a one-time thing. So, what were your initial, like, beginning days hurdles like with getting used to all these surgeries?
Well, lucky for me that my training for the first time PRP was done with a guy who actually invented the O shot. Dr. Reynolds is a person who invented the O shot, has got written so
Wow.
many well known. I actually trained with him. So I didn't have to do any of that. I just followed his protocols. And to this time, he does the journal club once a month. We talk about it. He has so many people who are a part of his group that they do the research. So I don't have time for researching. So I literally follow these protocols who have been published. So I took an easy way out.
How often do
No,
you see the patient return for the O shot?
The O shot is supposed to last from 1 to 5 years, depending upon the age and how many stem cells were there and how, right? So I just tell my patient, it's gonna last you at least a year, but once you start seeing that your symptoms are coming back, come back to me. So
And that increases like libido and like
it,
kind of sex drive. Okay.
it depends upon where you're putting the PRP. Yes, you can do it for and sexual drive if you have somebody coming for urinary incontinence. Depending upon where you put it in, there's a condition of the skin which is a very chronic condition called lichen sclerosis. I don't know if you guys have heard the name, but it's a very debilitating condition for a lot of postmenopausal women, and it's an autoimmune condition, so it's not a cure. Women do amazing with PRP for that. People who have scar tissue from vaginal deliveries and stuff, we put a PRP. So depending upon where you inject it, so yeah, it works for most of them, all of them, I should say.
So, when you are billing the patients, are there any like specific codes for any of these procedures, or is this something that you charge like, because billing and everything, all the codes is like pretty much insurance, right? But this is
Yeah,
not covered by insurance, so
covered by insurance. So you just whatever you're gonna, you charge, yeah, whatever
yeah,
standard. Yeah.
yeah. In one of my entrepreneurship classes when I was at Case, we talked about how everyone wants to be an entrepreneur, but it's hard to do well and hard to do good at the same time. And I feel like you're an entrepreneur in a very awesome sense that not only do you do well because you're running so many practices, but you're also doing good for so many women who are suffering with stuff that, you don't really see solutions for. So hats off to you for doing such a great thing for the whole community.
Oh, thank you very much. To tell you the truth, I don't know about being entrepreneur. My whole thing started by just helping the women because I love women's health. That's been my thing, and I think given a chance again, I would be back in women's health because it's a very empowering feeling when you do something and somebody feels good about it. So this came as a sideline, I would say, rather than my being my only focus. But thank you for recognizing it.
Yeah,
Well, I think it's
definitely.
great that like so many people see physicians and doctors wanting to go to medical school just to become a doctor to get rich and have all these nice things. Where it people who go into medicine are completely the opposite. It's not about the money, they want to go in and help people. And it's great that you kind of just fell into this line of work. You love what you do, and you also are very successful while you do it. And there are so many people who would want to be in your shoes. So, and hats off to you for just helping so many women who really need help, and especially in it's isn't it so weird that in the medical field where it's all about women doctors are like, it's like they're not underserved, but what they're like underrepresented. Like there
Yeah.
aren't too many women gynecologists. I mean, I know people who go, I know, girls who go to a female gynecologist, but a lot of them have to go to males and they're like, it's really uncomfortable. So hats off to you. It's great.
Thank you.
And I think it's also great to highlight the other things you're also doing for for younger women that are being introduced to their periods and stuff like that. So you have a pocket guide to your period that you have. So do you want to tell us a little bit about that book?
Well, that was something I wanted to do for the longest time because I do have a lot of my patients or a lot of my babies I delivered who are now teenagers or getting older. Moms bringing them because the girls don't feel comfortable asking mom the questions. The sex education in school is just it's like really
Yeah.
non-existent.
It's terrible. It's horrible.
So there are all these questions these teenage girls have, like simple things, and you try to find answer and they don't. And I've been educating, so I was thinking about writing a book for a longest time, but then COVID happened and my daughters were home and we just needed a project to do because here we are sitting and nothing happening. My office was closed too. So we just came up with the idea. I'm like, girls, you have gone through it. You know what questions you had when you were growing up, and they're good at. And I'm a medicine person, so one of my daughters helped me make it easier, like writing it in a language where the other girls will understand. One of them helped me just draw pictures and illustrate it. So it was a great group project. Actually, we actually had a good time doing it. And we learned a lot about how to publish a book and what to do and where to find an editor for, all those things along the same line. So a fun project.
Yeah, that's so awesome. And also I saw that not too long ago you had an interview with CBS Detroit. So that's like a
Yeah.
super awesome thing. So is that you're
Yeah.
like famous, we have a
Oh,
chance to talk to somebody. So
out of
like
it was
yeah,
exciting.
you
They were
want
to know about cosmetic gynecology as well. So
so did they find out about you through your social media and everything? Because Nick, she actually has a couple videos on TikTok with like 2+ million views.
What?
So
That's
it's
crazy.
like, yeah.
That's
social media helps a lot. Yes, it does.
well,
What's the farthest your patient has traveled to come see you because they saw you on social media?
I had somebody just last week come from New York. I had
Wow.
coming from Canada. I also had one from Canada 2 weeks ago. From a few. So I mean, Ohio, Illinois. I see a bunch of people. Carolina, one from Carolina. So yeah, there are
speaking
people.
of, sorry to cut you up, but speaking of people from other places, I want to go back kind of earlier in your career before you got settled in Michigan. What was it like, first going to medical school in India, then being in the United Kingdom, and then coming into the United States? What kind of differences did you see, and how did that kind of affect your outlook on medicine?
Um, the medical system in United Kingdom where I train is totally different than medical system here. It was national health, and when I left England, the national health was kind of not doing good, was kind of crumbling, and my patient had to wait a long time to get any procedures done. I remember if it's an emergency, we could just go in and do it. But if people had non-emergency situation and needed, say, a hysterectomy or whatever major surgery, they would be waiting for a year or more on a wait list. And though they were not emergent condition, patients were still suffering. And I just didn't like that. I didn't like that system where your hands are tied all the time. So I actually came here for 1 year only. I told my hospital up there that I'm going to just go and see how the system is here. And I liked it because at least I thought I had more independence. I can actually do what not what I wanted to do, but if a patient needed it, she can get it done. I don't think my patients wait more than a month to get a hysterectomy as compared to that. So there were a lot of advantages. I think the training up here was shorter, but very structured. Our residency program here was only 4 years, but was very structured because every year we'll get more and more responsibilities. You are trained that way. You're trained to become an independent practitioner. But in United Kingdom, when I trained, there was no end to the training. It was you take your own path, and it may take years before you get to that senior level. So I felt that I was getting trained to be a mid-level provider than an independent attending. So I really liked it here, and I think I still prefer this system over the national health up there.
Very interesting to hear. I think that's a cool. When you said that at the beginning, like, oh, that'll be an interesting question to see how someone who's actually a doctor has what's their opinion on the national healthcare in England versus, kind of the private healthcare of the United States. That's super interesting. Thank you.
You're welcome.
One other thing I see that you also offer Botox and stuff like that. So how often do you find patients getting Botox injections, and like what is your experience? Like, do you do like facial Botox or only like Botox in the like vagina area?
I do both. I do both facial as well as if they needed any vaginal Botox. Well, I really don't go and find patient. I already have a gynecological patient. It's a women's office. And so if they need a Botox, I'm here, I can give it to them. So that's how it started. It's like, well, you're sitting here wanting it, might as well, and they trust me, right? As a gynecologist. So they trust their face also with me. So it's more convenience for a patient than anything, and I enjoy it. It's fun. So
Yeah.
Yeah, no, that's great.
Well, I feel like we covered a lot of things, and we want to thank you for your time. Nick, do you have like anything else you want to ask?
No, this was great. I definitely learned a lot. I feel like we could sit here and probably talk for another hour. But it's kind of getting late. But no, this was awesome. This is definitely something we have not done on the podcast yet. Is get like a legit medical professional. Correct me if I'm wrong, Heen, but this is like our first doctor, first nurse anybody we've had, and I hope it's been a good experience for you guys. It's been a great experience for us. We've learned so much, and I'm glad we got to talk about some umbilical cord blood. I'm glad we got to talk about, some women's health issues. I think that that's a hot topic right now, and there definitely needs to be a lot more attention towards it than there really is. And one last time from me and him, thank you not only for coming on the podcast, but for the work you do. You do a lot for a lot of people, and you're really making a good difference in the world. So thank you.
Thank you, guys. I really enjoyed talking to you guys, and we'll keep in touch. And thank you for inviting me again.
Yeah, no problem.
Definitely.
All right,
guys.
everyone. Well, I got it. All right. Well, this has been another episode of Cells to Cell. We want to thank Dr. Mona for coming on and wish her best of luck in the future. But yeah, I'm Nick. That's him, and we'll see you guys next time. Boom.